Okay. So the patient injects 28 units of insulin every morning and 8 units at bedtime. The patient checks blood sugar 4 times every day. The patient's weight is stable and the diet is unchanged. However, the patients report several hypoglycemic reactions every week. The nurse knows most likely the cause is so. According to the question, the patient is perfect, isn't it? The patient is already having insulin dependent mellitus. IDDM is there. So the patient is doing the, you know, patient has begun to self manage with the parental supervision. Patient is taking 28 units of insulin in the morning and 8 units at the bedtime, and they check the sugar 4 times every day. Weight is stable, but again, hypoglycemia is always there. In spite of doing everything, what is there? Hypoglycemia is still having hypoglycemia. So according to the question, the patient is perfect. But why this patient is having hypoglycemia? So these are the options. The patient is not eating the adequate number of calories reported. Okay, we are saying the patient is not eating well could be the reason. The dosage of insulin may be decreased. We have to decrease because the patient is growing. There may be changes in exercise or stress levels or the beginning of a growth spurt. This could be the answer. Why? Because that is a child, and when there is growth, there could be change in the level according to the growth spurt. Okay, or because of the exercise. Yes, because when we exercise more, you need more insulin. When you stress more, you need more insulin. The patient may not be competent in techniques of drawing up and injecting insulin. So the answer is C. According to this, during exercise or during stress or during growth spurt, the patient is expected to have more need of insulin. So that is the reason for the hypoglycemia. That is the reason for hypoglycemia. A nurse visits a patient at home who does not understand how to take a newly prescribed medication. So, nurse visits a patient and he does not understand how to take this newly prescribed medication. The prescription reads 5 ml per oral TID PC meals. Okay, what is the answer? So, this should be 1 teaspoon by mouth 3 times a day after meals. So PC meals is after meals. Okay, PC meals is after meals. So that is 1 teaspoon. So the nurse explains to the patient that the current weight. So this is, since it is 5 ml, it should be 1 teaspoon. 1 teaspoon is 5 ml. Okay, 1 tablespoon is how much ml? 15 ml. And it is written TID. TID is 3 times. If it was BD, it is 2 times. If it is OD, it is 1 time. And it is written PC. PC is for after meals. Okay, PC is for after meals. After meals. Nurse is caring for a patient who had major abdominal surgery. So the patient had major abdominal surgery under general anesthesia 4 hours ago. An appropriate goal for the patient includes, so patient had abdominal surgery, having minimal fine crackles in the base of the lungs, using incentive spirometry every 4th hourly, expectorating minimal amount of secretions, performing coughing exercises every hourly while awake. So this is the answer for this question, that the patient should perform cough exercises every hourly while awake. Having minimal fine crackles in the base of the lungs is not expected. There should not be fine crackles. Okay. Using the incentive spirometry for 4th hourly. So usually incentive spirometry is not needed for those who have had abdominal surgery. Usually for someone who has undergone respiratory surgeries, we will give incentive spirometry. Expectorating minimal amount of secretions. Expectoration of secretions is also not that expected. Okay, so performing cuffing exercise. While caring for a child with atrioventricular peritoneal shunt, so the patient is having atrioventricular peritoneal shunt. Revision. The nurse find the patient lying with the head and feet flexed back. So the nurse should call for help and prepare for a ventricular tap. Okay, it is ventricular tap. So the options are spinal tap, shunt culture, ECG, but it is ventricular tap. Now, detail about this atrioventricular peritoneal shunt is given in an other slide. Okay, please refer to it and understand about AV, atrioventricular peritoneal shunt. What is AV shunt? What are the reasons for putting AV shunt? And what is the name of the surgical management? And importantly, what are the nursing management? So these many things you should understand about the shunt. During surgery requiring general anesthesia, the patient's heart stops and a carotid pulse is not palpated. So heart stop and there is no carotid pulse. How many compressions per minute should be administered? So this is all about what cardiopulmonary resuscitation, and this is the compression. It is the number of compression. How many? Okay. We have to give how many number of compression is the question. Okay. How many? It should be 100. 100 compression should be going in a minute. That is also important. 100 should go in a minute. Okay. When teaching a community class on cerebrovascular accidents, that is stroke, which of the following should participants of the class know at the which of the following? So the question is which among this following A, B, C, D the participants of the class should know at the completion of the class. So when the patient is undergone CVA, when the patient has had stroke, there is a risk for mood disorder such as depression. Okay. So this is the main thing. Muscle and ligament damage is not reversible. No. Expressive aphasia is resolved by voice rest. No. Liquid should be consumed at the same time as solid foods. No. Because why all these things are known? No, is because we do not know which part of the CVA we are talking about, isn't it? So muscle and ligament damage is not reversible. With proper physiotherapy, you can improve the strength of the muscle. Expressive aphasia is resolved by voice rest. You cannot reverse this by voice rest. That is a complete wrong statement. So this is complete wrong. Completely this is wrong. And liquid should be consumed at the same time as solid food. Someone who has got a stroke in the left side of the brain, they will not be able to they will not be able to masticate or, engulf or swallow the food. So for them, you cannot advise them to take liquids and solids. So that is also wrong. A community health care nurse visits a patient who had CVA. So the patient had CVA. The patient is at risk for deficient volume due to voluntary reduction intake fluid to avoid the use of the bathroom. So yeah, the patient. So what has happened? The patient has had stroke. Okay. So this patient doesn't want to go to bathroom. So voluntarily she or he is not drinking fluid. Okay, he is not drinking. Not drinking. Okay, why? Because if he drinks, then he may have the urge to urinate frequently. So he has decreased the drinking voluntarily to avoid the use of bathroom. The nurse educates the patient on the importance of drinking fluids and maintaining hydration. Which of the following indicates the efficacy of nursing intervention? So, amber color of urine, tachycardia, respiration, all these are wrong. If the patient is having moist mucous membrane, that clearly shows that the patient is hydrated. Okay. So, by looking at the color of the urine, if the patient is having amber color, that shows that the urine is dehydrated. Okay, dehydrated. When the patient is having tachycardia, it is dehydrated. When the patient's respiration of 35, the patient is again dehydrated. So, very important, the moist mucous membrane. That is the answer.